providing Narcan to nurses and school resource officers as well. Here in Hamilton County, school nurses started receiving Narcan training last year. Since then, the drug has been used on only one student. The school system's manager of health services, Cheryl Fletcher, says she has seen nurses' roles become even more important. She says nurses know they need to be ready if the opioid problem accelerates in our schools.
Tennessee has an opioid problem. Hamilton County is part of Tennessee. It has an opioid problem. So what happens? When the community has a problem, it has a tendency to impact the schools. Whatever goes on in the community, we have to deal with it in school. We try to manage as best we can in our school settings.
And thanks to partnerships with the Tennessee Departments of Education and Health, the Narcan program in Hamilton County is provided at no cost for schools. Now, schools in Walker County, Georgia also use grants to bring Narcan to nurses at no cost to taxpayers. Since the program started last year, nurses have not had to use it. School nurse John Logan says he and his colleagues are trained on how to recognize the signs and symptoms of overdose. They're also trained on how to administer Narcan through the nose. He says he believes the epidemic is impacting Walker County, and even though nurses haven't yet had to use Narcan, he wants them to be ready.
We can't perform if we don't have the tools in our toolbox. And so this is a tool in our toolbox that helps us in a need of intervention to have that. And it's a life or death intervention. I mean, if we don't have it, then it's not a good thing. It's not going to be a good turnout.
And on a side note, he says he's also concerned about the safety of school resource officers. Due to the strength of drugs like fentanyl, officers are at risk when they have to examine these drugs.